After having knee surgery, every patient wants to recover as quickly and as pain-free as possible. Today, I'm going to be talking about the 3 worst mistakes someone can make after surgery that will not only increase their pain and swelling, but it will actually prolong their recovery. Let's get started. Mistake number 1 is being way too overconfident after the surgery, especially during the first 2 weeks after the procedure. Some patients will feel that they're stable and balanced enough that they don't want to use their assisted device, so their walker or even a cane. They'll say that they'll have minimal pain with walking and with standing, but in general, they'll just feel very confident in their ability to walk, even though it's not a normal walking pattern. However, if you ditch the walker or even a cane too soon that first 2 weeks, especially the first week after surgery, what's going to happen is if you're not a fall risk at that point and you're just putting extra pressure, extra stress on that knee joint, then you're just going to increase how much inflammation at that knee above and below the joint. So in the first 7 to 14 days, there's still a lot of healing occurring, and your muscles aren't fully turned on after that procedure because it's pretty invasive. They're essentially dormant, and you have to work on activating and turning on these muscles. So when you're standing and walking, they're not working, these muscles specifically, they're not working as efficiently and to the best of their ability because it was a very traumatic procedure. So when you're walking and standing, every time you take a step, you're going to be walking with essentially less function in the muscles. So their ability to take some of the pressure and the weight off of the actual joint itself is going to be less in the first 1 to 2 weeks. So what's happening is if you ditch the walker, because the muscles aren't working as well as they should in that first 1 to 2 weeks, more stress is occurring on that knee every time you take a step. And now you're increasing the inflammation because there's more impact, even if you're walking slow. So that's why just because your fall risk may be low without an assisted device, you're actually just causing more inflammation. So we still want you to use an assisted device, a walker or a cane during the first 1 to 2 weeks, just to at least take some of the pressure off the knee if it's not for a fall risk. Mistake number 2 is going up and down the stairs or a step the wrong way. So before you get discharged to home, typically you're going to be going over how to go up and down a step or a stair if your home has either of those, just to make sure that you can be functionally independent and be able to perform that transfer, that going up and down the stairs safely. Now what happens is some people will get too comfortable and they'll rush going up or down the stairs, and they'll not acknowledge which leg has to go up or down first. And that is very important after surgery, because if you do the wrong leg going up or down first, you're going to cause a lot more pain, and that's going to prolong your recovery, because it only takes one step, whether you're going up or down, doing that the wrong way, for you to have pain and swelling for the rest of the day, maybe even the next couple of days. So in a general rule of thumb, when you're going up a step or a stair, you want to step up with the non-surgical leg. So ideally you want to use the railings to help your balance, to make sure you're pretty stable. If you only have one railing, then usually it's one hand on the railing and the other hand using a cane. But in terms of which leg goes first, when you're going up a step or a stair, the non-surgical leg is going to go first. Now, it's opposite when you're going down. So when you're going down, you want to step down with the surgical leg. That surgical knee side is going to step down first. And when you're using a cane, just remember that the cane is always going to touch first. So when we're talking about going down, you have one hand on the railing, the cane goes one step down, and then you lead with your surgical leg, and then your non-surgical leg follows when you're going down. So again, if you're going upstairs, you lead or you step first with the non-surgical leg, and when you go down, you want to step first with the surgical leg. The third mistake that is too common is not elevating that surgical leg enough. So when people are icing, they're pretty good with elevating the knee, the leg above the level of the heart. But what happens is when they're not icing, and they're either taking a break from ice or maybe they're eating a meal, they're bringing their leg down in pretty much like a regular sitting position where the leg is on the floor. It may not be fully bent, but it's just going to be on the floor. So it's way below the level of the heart. And they'll stay in that position for too long. Essentially, too long is 30 minutes is what I go by. Especially if it's within that first 1 to 2 weeks after surgery. You primarily want to spend as minimal time during the day, especially with the leg below the level of your heart. Obviously, when you're walking, when you're eating, when you're going to the bathroom, that leg is down. But if you're not doing one of those things, you primarily want to keep that leg elevated above the level of the heart as much as possible in that first 1 to 2 weeks, because if you keep that leg below the level of your heart when you're at rest and you stay like that in that position for hours at a time, you're going to have poor circulation, which can possibly lead to a DVT, or that swelling is just going to build up immensely, not only at the knee joint, but even at the calf, at the ankle, and at the foot. So just to best maintain your swelling and edema, keep that leg elevated as much as you can, even if you're not icing. If you're just resting, you can keep the leg elevated above the level of your heart. So to recap, the 3 things you want to avoid are ditching the walker or assisted device too soon, going up and down the stairs the incorrect way, so leading with the wrong leg, and you want to avoid any positions that your leg is below the level of your heart for too long. You want to spend most of your time with that leg elevated. Now, if you don't abide by these and you do these mistakes, what's going to happen is your swelling and your pain are going to go up, which is going to overall prolong your recovery, because if your swelling and pain are up, you're not going to be able to tolerate the exercises that you need to do on a daily basis. And in terms of your range of motion, with that extra edema and just swelling around the knee joint, you're not going to be able to bend, you're not going to be able to straighten the knee as much as we need to hit those target range of motion measurements. So just make sure you avoid these 3 mistakes at all costs, because they are preventable. So as long as you keep in mind, then you'll be just fine in terms of staying on track with your recovery timeline.